Shalom. I would say shalom, hello, peace from my star in the galaxy to your star into your living room, to your office, wherever you're at right now. Good afternoon, good morning, good evening. My name is Dr. Tovah Goldfine, and this is TMS Roundtable Recovery. And for those of you who are joining us for the first time, we've been streaming live weekly with incredible guests. It's been about 6 years, nonstop, going on, not stopping. Jeannie and I stay together. Doctors, therapists, movie directors. We've met authors. We've met scientists, neuroscientists, individuals who have recovered from every kind of chronic pain and autoimmune condition you can imagine. I'm joined tonight by Jeannie Kulwin. Occasionally, Jeannie will pop in and I'll ask her to co-host with me. Jeannie always brings deep insight and live experience, really lived experience to these conversations. Tonight, we're diving into a topic that's really, really important and close to all of our hearts: how mindfulness and meditation can truly help us recover from chronic pain and neuroplastic symptoms. Fact's a fact. Our guest, Dr. Matt McClanahan, is an osteopathic physician who's board certified in both neuromusculoskeletal medicine, the nerve, the muscle, and the skeleton, and also family medicine, and the founder for the Center for Insight Medicine. He also holds a master's degree in exercise physiology, and has extensive training in prolotherapy, which is a really quite amazing inflammatory treatment. I know a lot about that. It's unbelievable. But what makes his work especially meaningful is how Dr. Matt blends science, mindfulness, and compassion into the way he practices medicine. This is the future. Through his own personal and professional journey, Dr. Matt began to see that true healing happens when we consider the body, the mind, and the spirit as one, no separation, and that awareness and the nervous system regulation are at the heart of transformation. Matt, your work beautifully bridges medical science with contemplative spirituality, offering a path toward integrity, presence, and the body's innate ability to heal. So tonight we're going to explore how stillness, how awareness, how being triggered like me sometimes when I do this, and mindfulness can help us reconnect with our own healing potential, especially for those navigating chronic pain and autoimmune illness and neuroplastic symptoms. So, Dr. Matt, we are so honored to have you here, and welcome to my holy virtual studio and to the round table.
Thank you. Yeah, it's really good to be here. I'm really honored to participate with y'all.
So we're going to start talking about, because, let's lean back into Sarno. Sarno, one of Sarno's 5: journaling, knowledge, mindfulness, meditation, and I think all of us as coaches and you as a doctor, bringing, and I think since the Harvard study many years ago, the guy from Harvard who said, meditation, there's a science, it's bringing down your blood pressure, you take less, like that was a big thing in the medical model. I forget his name. Did that.
John Kabat-Zinn?
Yeah. And even before that, the guy in Harvard did a study
Okay.
down blood pressure, and it was, years ago. So I think what I'd like to open up the conversation, the dialogue, and reach our listeners is chronic pain, symptoms. What does mindfulness have to do with what this is the kind of thing where, like, let's just even look at the science behind the breath and the mindfulness.
Yeah, these are great questions. I mean, there's a sort of Americanized distillation of a lot of Buddhist thought that goes pain times resistance equals suffering.
Well, I like this. Wait. Pain times resistance equals suffering.
Yeah, you write it out like a math equation or something. And so, TMS or neuroplastic symptoms, we would call this is suffering actually. It's not the pain, which is tricky because that's what a lot of people think, or pain is pain, right? All pain's the same. And we know that's not true. And we know there are different sources and things, but I think Alan Gordon has done a really good job furthering, John Sarno's work, and all of us contribute to this, but really talking about neuroplastic symptoms as a fear problem, and that the target, especially in even like a technique like somatic tracking, which involves mindfulness, but um, we're not interested in reducing pain. We're interested in reducing fear, and fear is the resistance, right? Whether we're fighting our symptoms or fixating on them, or getting frustrated by them, or all these F words that we talk about, getting forlorn or freaking
Success.
out, or
Success.
freezing, or yeah, all of these things. They're all part of the resistance channel. And so when we can really lower our resistance to what's happening, to our experience in any moment, that actually affects like what happens. That affects how our consciousness experiences whatever, whether it's back pain or fatigue or conflict with your spouse or whatever. All the ways we try to manage it.
So how do we, like the Buddhists say, lean into the resistance? Even Dr. Alan, the ISTDP, Dr. Alan Abbas, his book is called Reaching into Resistance. So how do
Reaching
we
for
yeah,
resistance.
reaching through resistance. So how do we understand that the resistance is our friend? How do we teach people in pain that the pain is their superpower? Like, this is elevated, this is high, but let's break this down, Jeannie and Dr. Matt. How do we help people see the resistance is a place to lean into through meditation? So there you go. So what do you
Well, I
guys
think
think?
yeah, I think using the body more, the meditation, especially if you can maybe focus on your breath or your chest or your belly. Sometimes I recommend maybe not focusing on a mantra because now we're still in the mind. But if we can get into the breath or with somatic tracking, it's all about the body. It's the stillness. And we always talk about, we share this as TMS, but this is the mind body connection, mind body syndrome. And we just spend so much time in the mind. And so it's just a radical act to get into the body with stillness, whatever that meditation is. It could be an active meditation, it could be the breath and the body. That's where your healing, your safety, your wisdom is. And we're terrified. Yeah. So we're terrified of being in the body. So I think the breath is the bridge, right, Matt? And getting into the stillness and the body.
Yeah, I mean, the breath, yeah, absolutely is the bridge. It's a bridge. There's a lot of ways to get to the hub of the wheel, a lot of spokes, but um, you know, I think even before, is it a body scan? Is it an insight meditation? Is it a breath focused meditation? Like, which one's best? Um, that's maybe the wrong question. Which is the best way in? You know, I think in where a TMS work at its best um, is when we're helping our patients, clients change their relationship with their symptoms, change their relationship with themselves,
Mhm.
and helping their minds, their brains to access new experience. So if there were three words, I would say it's awareness, relationship, and experience. That these are the things, and that mindfulness is a great tool and route to start to begin to change your relationship with your pain or your fatigue or your anxiety or your anger or anything. Um, but it's relationship and experience and awareness are like a wheel, and they keep turning and turning and turning. A new experience, like actually somebody doing somatic tracking or some emotional, like expressive writing, and contacting emotions that are usually out of awareness, and then they see their symptoms come down as a result. This helps them to change their relationship with it. And so the intention, and this is something I talk about with my patients a lot, like the intention that you bring, the awareness and the intention and how you choose to respond is actually more important than like, is it the breath or is it a mantra or is it whatever? It's like, if your intention is self connection and self protection, wow, what we're now in the relational domain. This is good. There's a sense of like we're dancing with our symptom rather than just like trying to hammer it down. And I've had people, I've done this. I took a whole mindfulness based stress reduction 8-week course back in 2015 as a way to get out of pain. Well, it didn't work. It helped me in a lot of other ways, but
Yeah,
like,
that's what I wanna talk about too. That's what's
yeah. So what's
Tell
your,
us why it didn't. Can you share why? I mean, like,
because I was still trying to get out of pain, not
wow,
trying to not
wow.
trying to connect with myself, right? And I thought my pain, I knew stress was related to it, but like John Sarno was really clear that stress doesn't cause TMS, right? It's the resistance, it's the ways we try to manage stress or push it down, the resulting emotions, or the parts of us that feel lots of displeasure at how we're being treated in our job or in our marriage or whatever. Or I've got a 3-year-old and it's I've got to routinely sit down and take time to privately often to authentically express like how much I hate parts of parenting. Like it's so hard. And it, like,
Job in the universe.
yeah, it is to make a healthy attachment and an integrated person. Like it's really a lot of work. It's great, beautiful work. And it's the most important thing I think I've ever done. And my son is just this amazing uh human. And I'm so thrilled. And I hate it sometimes. And so how do I, when I try to resist that or be good or just kind of like endure and muscle through and do the right thing, I'm denying the parts of me that miss my freedoms and sleep and and all of that.
So
And so resistance, right? The resistance is what starts to, the stressors are coming up and they push up, and then the resistance comes to say, don't do that, or that's too much or whatever. Rather than mindfully with awareness and relationship and experience, like allowing these parts of me to speak or have a voice anyway, and to take them seriously. And often they sort of like go away, like when they feel heard or seen, or these emotions can get completed, right? We can complete like a good cry. You feel like cleansed afterwards. Like you didn't resist it. You didn't try to manage it.
yeah,
You just let your system do what it does. But, and that's like skills in mindfulness of like just attending to what's there and in some ways following it, following my body or following the emotion rather than trying to like get out ahead of it and manage it and, make sure it's appropriate and that there's a good life lesson at the end of it or something. Like it's
yeah, good
messy.
point. I think it just brings up two important keys for our audience and for our, you know, one, it's so difficult. It's like a new pathway, and none of us learned this growing up. It's not, we're not blaming parents. And even if we learned it, we need to learn it again. But
Mhm.
the pathway of stillness, to be in the moment, to being and not doing. This is something we have to learn over and over again. It's a pathway. It's a circuit. It's a habit. And I think this is a key. If we can move into that stillness, which is scary, and see that it's just, I always call it like the monster under the bed, which is a toy monster.
Mhm.
And then we're back to talking about like, because this calms our brain, and then we're doing the neuroplasticity, and then you're meeting your lizard brain where it's at. You're not trying to, it's you and your
Yeah.
lizard brain. So I would love to hear the two of you talk about stillness and the lizard brain.
Well, I think so many things have changed since Sarno wrote his books, right? The internet and social media, and in the old days, I don't know, you would check the stocks. I don't even know. You would check your stocks maybe in the newspaper or something once a day. And now in your hand, you're seeing the stock market every second, or fantasy football or whatever it is, like every moment. And back in the olden days, right, we didn't have access to the news and changes and scariness. And so I just think it is different nowadays. There's a lot more coming at us. There's more stimulation. There's more access to news and this is a choice. We get to decide, we get to be intentional, so we can't just blame it on, I mean, it's good to be aware, right? These things exist that didn't exist before. Before is just maybe the TV, the news, the radio or something, and now it's coming at us at all these things, but it is our responsibility now, our relationship. There's a lot of excuses why we can't be still. And when you're still, remember that's how Dr. Matt said, I mean, our emotions are in the body. How are we going to do somatic tracking? How are we going to feel our pain if we can't ever be still? It's bringing this safety. So I get it. We don't want to be still because who wants to feel the emotions, the stress, the TMS symptoms? So maybe, Dr. Matt, what would be something if someone's afraid of stillness or doesn't know how to start? Is there something that you recommend for newbies to this arena?
I mean, I would explore the resistance to stillness. Like,
Yeah.
tell me what happens inside. Like, what when you slow down or when you try to quiet your mind, what comes up? I was a pretty active kid, energetic, just little boy, I think. And, I'm not sure if classrooms are the ultimate best, sitting in rows and all day long is the best way for all little boys to learn, maybe some, but, um, and what are you going to do? I mean, I don't know. I just go feral otherwise. Like, so, I mean, I see that, but I got in trouble a lot for wiggling, but I probably like, I don't know, in this day and age, maybe I would have been medicated for ADHD or something, but, um, my
Wow.
parents didn't wanna do that, and, to their credit, and maybe, who knows, but, I had a lot of there was a lot of activation inside me, and that wasn't all just being a boy, some of that was anxiety, and things inside me that really wanted to come out, or, parts that needed voices that it's not the space or the time to do that in class, and, you know there are a lot of people, and myself included, where there's a time where somebody would say, if we just gotta you just gotta be more still, just use the breath and get more still. And in a way that sounds like, can you just calm down? Like, shh, 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 shh. I was taught, that was done to me a lot in my life. And there's nothing more like infuriating than when I'm upset about something that somebody tells me to calm down.
Yeah.
And so in some ways we want to listen, because there's often the energy behind our frenetic pace and our distractibility. That's often protecting us from like a depth of pain and anxiety that is actually worse than in some ways what we think. And so from that standpoint, like, um, I think maybe it's Pema Chodron would say, what's in the way is the way. And so just that notion of like, boy, I just can't meditate, or I can't get my mind to calm down. Like, okay, something's in the way, or like that pain or that dis-ease that you feel when you're trying to meditate and you just can't. Um, that's worth inquiry. And maybe there's been seasons of my life where I needed to stop meditating or stop practicing any mindfulness, because I needed to work on emotions, or I needed to work on like build some awareness around like what is this conditioned response that every time I sit down to practice some mindfulness, my mind goes everywhere else than this moment, and it led me to attend to a lot of different kinds of dis-ease in me. Um, so I think for sure, when we can slow down and we can like regulate our breath, and we can attend to what's happening in our bodies and minds and around us in the moment, um, this really helps our nervous system to move towards this parasympathetic state, and yeah, like you're saying, out of this sort of reactive, volatile, lizard brain, if you will. But it's meditation and mindfulness are hard work for us, and that difficulty is worthy of our exploration.
Yeah. Yeah.
And sometimes, um, just sort of telling ourselves to calm down. Uh, if my kid was sick, or gosh, what I was using some um, a metaphor with a patient maybe just yesterday, in this notion that I think I was talking to you about this right before we started, but this idea that if I could just, can it just be okay to want to get out of pain? And like, yes, it definitely can, of course. And that's what brings people to this. Um, and there's this, I don't know why this came to me yesterday, but there's this concept of something called a hair tourniquet. Have you ever heard of that with babies? Like maybe one of your longer hairs, you've taken care of your baby and one of your hairs kind of fell in the diaper or has gotten wrapped around their toe. And sometimes, or their penis or something, it creates a tourniquet. Actually, they can lose a toe or worse,
Wow.
right? But it can cause like real ischemia to this little appendage,
Yeah,
whatever
it
it happens
does.
to be. But there are times where you've tried to feed your baby and you change their diaper and you've rocked them and they're just not crying. And it's so irritating. And can't you want your baby to just stop crying? And like, of course you can want that.
Yeah.
And if there's like a little tourniquet around their little toe or something, it's just this innocent thing that happens. Like you would want to know rather than just to make your baby shut up.
Yeah, yeah, of
Right.
course.
And so the same thing for us, like often it takes stillness or calming down and like scanning this baby to just to make sure like this thing isn't happening. And they're like rare and not rare. I mean, they happen. It's happened to my kid a little bit.
Oh,
He's
I've heard of
not,
it. I've heard of it.
not in a terrible way, or he didn't get damaged or anything, but we've seen these little hairs get wrapped around his toes. And boy, what a terrible thing to just like be so mad at the baby or want to just shut him up when he's like, this thing is
Yeah,
there for reasons.
yeah,
The stillness often can lead us to the reasons
yeah. Well,
if we can build the awareness to sit with it long enough.
s
Um,
can
yeah.
can we fairly say, like, on the record, can we say that, just like anybody learns a habit, riding a bike, driving the car, you know, no remembering your like, is it possible to say that we can learn stillness, that we can learn meditation and practice and enormous patience and love and compassion, 1 minute, 2 minutes? We're not here to be Dalai Lama. We're here to just watch our thoughts and be a witness. And so I want people to feel inspired and to know that it's not about being smart. You're already smart and sensitive if you're even have TMS or neuroplasticity. You're already a smart and sensitive person. You already have a heightened awareness. Let's channel that awareness to serve us
Yeah.
and see how we can, you know, like I call coming from fifth gear to second gear. I'm not going to ask you to go to first gear or stop the car. Just hang out with me a little bit in second gear.
Mhm.
Love sharing with patients, clients, the whole growth mindset framework, which you've heard me talk about. And anytime we talk with any doctors, we know neuroplasticity, that you can rewire the neural pathways. We know that you can get better at anything if you adopt a growth mindset. So, of course, if you say, I can't, it's too hard, I can't, and you're also programming your subconscious mind, right? I can't meditate, I can't. So, if you say that every time, then, excuse me, the subconscious is, oh, we can't do this. She tells me 5 times a day that we can't do this, it's too hard. But if you adopt this growth mindset that you can get better at anything, which we know from neuroplasticity and neural pathways, to Doc Tovah's point, you can just get better 30 seconds to 1 minute to just, you don't have to be. And that's again with our personality traits. Sometimes it's this all or nothing perfectionist. So now this is all coming together. This is what it's here to help you. It's to help you get out of that perfectionist. I'm not perfect. I don't do it like somebody else. That's the lesson. That's what you're supposed to learn
Wonderful.
Mhm.
moving through
Mhm.
that. Yeah.
Good point.
Yeah. Yeah. John Kabat-Zinn, this sort of like, probably really, really the most instrumental or the first instrumental person in bringing, you know, Buddhist principles and practice into like a bit more of a Western palatability. He had these 9 qualities of mindfulness, and the first of which you were just highlighting this growth mindset. But this one of the factors that leads to a growth mindset was what's called beginner's mind,
Mm-hmm.
and
Love
that's
it.
this notion that like how many times does my 3-year-old son who can walk now, but like when he was 1 year old and just taking his first step, how many chances does he get? Like as many as it takes, right? And so there's no timetable on that, and um, yeah, that beginner's mind is just this capacity to that there's, and this is a Tony Robbins quote, there's no such thing as failure, there's only outcomes.
I love it.
This notion that like, okay, well, it's all information,
Yeah.
right? No matter what you do. And so
Yeah.
the other qualities, I mean, I might just read them off
I'd
here, but
love to hear the 9 ones. I'd love it because it'll be on the record and people can,
yeah, you can just Google this too. John
go ahead. The
Kabat-Zinn, 9 qualities.
beginners,
Yeah, patience, okay, trust, acceptance, non-striving, letting go, gratitude, generosity, and non-judging. And so, like, though, when we talk about all neuroplastic symptoms, TMS, I mean, we really, I find it really, really helpful rather than like, well, is this IBS or is this, is this a migraine or is this chronic fatigue or is it just good old back pain? Um, that's all fine, but like at the end of the day, it becomes this relationship between safety and threat in the nervous system. And when we can look at these sorts of things, like what are the qualities that foster safety in our system? Well, it's not just like the breath work. It's like these qualities, right? And it's not just like a transcendental meditation, which is mantra based or something, or is it more of like an insight meditation, or is it Zen Buddhism? Which is best? Well, it's kind of the wrong question. Like, what's best? Which one's best, the in breath or the out breath? Well, that's like, what a silly question that is. You might like one or the other better or something, or one might be more needed in this moment, but these qualities that describe a relationship, right? Patience and trust and non-judgment and
attitude.
acceptance. Wow. Okay. So these are relationship words. How can we change our relationship with our felt experience and our experience of pain or our experience of pleasure, our experience of confusion or our experience of competence? Like, how can we bring more awareness, more relationship, and more experience, or a more like a fuller, less resisted experience? And that's the best of the questions as it regards this. And honestly, it's interesting. We're talking about, well, what's the best technique? No, it's relationship, experience, and awareness. And you build the muscles of awareness, relationship, and experience through practicing mindfulness.
Right.
And all of that allows your system to feel like it fosters safety inside and moving out of that threat state in the sympathetic, fight, flight, freeze and fold, that kind of thing, and over to the rest, digest, repair, like a
Yeah.
neutral or, um, you know, uh, Doc Tovah, you said something about shifting gears. And I like your metaphor. I want to build on it actually, because I think stress states have to do with like the RPMs of your engine. And if you've ever driven a manual transmission car, well, if you're on the highway driving 80 miles an hour and you shift from fifth to second gear, that's not good, right? That actually speeds up the engine. And a lot of people, I use the metaphor of being in the wrong gear. And
Mm.
if you're driving fast, and we need to drive fast in life sometimes, we need to be in the right gear. If you've got 5 gears, you want to be in that fifth gear when you're driving fast, because then that takes the engine RPMs down 3,000 or whatever into a healthier thing. And if you're going really slow, you don't want to be in fifth gear, this big gear, because your engine's going to bog down and you might like stall out the car. You just want to be nice and in tune with like, well, there's not that much going on in life. I can handle first or second gear a little bit. And so the engine idle, or the RPMs of the engine are never getting like way up ahead, or getting to this overly low level where we actually need responsiveness and we don't have it.
Yeah.
So we want to tune up, and it takes mindfulness and awareness to understand, like, what do I need right now? What does my system need?
Yeah.
Where are my RPMs right now?
Yeah.
Right? Maybe I need to be in fifth gear, but like fifth gear is actually really, it's much more efficient if you're like, there are stressor filled times of life.
Of
And we
course.
need
I
and we need
mean,
high gears for these. Um,
exactly. I mean, I have a theme of the week, and I talked about this week outcome independence, and somebody kind of challenged me on, like, sometimes we need to have an outcome. And I was like, Of course. I mean, we need to um expect something and make it happen. But I think when it comes to chronic pain and this kind of healing, especially, the PRT work, it's just very gray, and then this is not black and white. I wish we could be black. People need black and white. Our personalities, that we want black and white. We want it, but this is just many shades of gray, and there you just spoke about it as well. Fifth gear is important. I mean, you know, it depends on the situation, depends on the person. So we're now back to the individual, what you need, what's best for you. I mean, like unconditional love and acceptance, radical acceptance of that you're all, doing the best you can to, meditate for a minute, 5 minutes. I mean, this is not a race. And I wanted to bring up, and then I'd like to see if there are any questions. Um, the breath. I I talk about something called mindful moments, and it could just be a moment. And if we can focus on our breath, like I keep wanting to find this on Dr. Google, but is it true? Isn't it true that when we're focusing on our breath, that we won't feel pain because I'm focused on my breath? Isn't that the salient network, or more like the focus, Dr. Matt? Do you have a comment about that? Or because I kind of quote it, maybe I'm not quoting correctly.
Um, I mean, I can see that. I don't know it right off, or the literature that would say like that is a one-to-one kind of thing. I would think if you've broken your leg, you can try some breath work, but morphine's going to do a little better for you um in these moments. But like um but it has to do with like your sense of power in the moment, and the sense of safety, and the sense of efficacy, and like I am both connected to and protecting of myself. And if I think the breath is a really like direct way into this self-connected, self-protected state,
Right.
um
Right.
that yeah, you can it's all in there, and it's up to your choice and your own capacity to relate to it and experience the breath. Like, what does it really feel like, rather than like, is it 20 breaths or is it 30 breaths? Is it Wim Hof style, or is it like a pranayama? What's the best kind of breath work? And like, um, whatever you like, whatever feels better, whatever resonates to, we're not just trying to shift our state all the time. That can be important. Okay. There's time and a place, but like heroin addicts try to shift their state, and alcoholics. And that doesn't develop insight or any kind of like capacity to look into the sources of your suffering and change your relationship to it. Right. It just helps you feel better, and regulate, and alleviation and regulation are part of a spectrum of like recovery, and self stewardship, and relating to your nervous system in a way. But like the breath can also take you to these states where like a lot of fear is coming up, or a lot of anger. And great. So can you use the breath as a resource to help you feel more deeply and
Yes.
feel through? Like I was talking about completion, like a good
Yeah.
cry, or this kind of
Yeah.
thing. This sense of completing your feelings. The breath can really be this thing that not only supports you like a crutch a little bit, but it can also be this like it can build its own momentum, so that you can keep taking the next step and the next step towards feeling through your feelings, rather than a lot of you don't after a good cry, you don't have to worry about like, oh, I should choose to let go of my grief. It's like, well, it's kind of gone. It feels like
Right.
it's completed.
Right. Right.
Right. And so that's what we're after. And whether it's anger or joy, or some sort of like guilt or sexual feelings or whatever, all these things can be completed as long as we can stay with it. And the breath can be this thing that really helps us stay with it.
Grounding. And I know Jeannie, for when I first met Jeannie a few years ago, you were doing a lot of this mindful work, and I did one of your classes, and I didn't relate to it because it was on Zoom, and I was like, I didn't know it was so much. I know much more now about the breath and mindfulness, but you were doing some mindfulness work. You want to share a little bit about
Yeah,
that? What that was for
I fell
you?
in love with breathwork, and I'll put it on the record, and just like Tovah put it on the gallows about, for me, I'll just say for me, breathwork literally changed my life. I had no idea how to feel emotions. I was stuck in my ego. I mean, if it wasn't for breathwork, I wouldn't even be here, because I was listening to my ego 24/7. I was staying in a job that was unfulfilling because it was safe. And it's true, like it was safe. I was a teacher, Dr. Matt. So had the safe job with a pension and health insurance, and I was really sick, so health insurance was really important. So I stayed in the ego and the fear and the scarcity and the lack. And breath work really allowed me to silent the ego temporarily and get whoosh back into the body, which is the stillness, back in the body and into my intuition, which said that I'm going to figure this out. I'm going to hire someone. I'm going to try. I'm going to make mistakes. Oh my gosh, I don't have to do it perfectly. And that also allowed me just to release this shame that I felt or sadness, the medical trauma, all the trauma I had gone through in
Mm.
such a long battle. I mean, and when I found this work, I didn't know anyone who had healed from it. I wasn't like kind of like the typical found the recovery groups or anything. I'm kind of like doing this by myself. So the breath work allowed me to release, yeah, a lot of these stuck negative emotions that I had been carrying for decades. So it's not for everyone, but like what we're talking about is finding what works for you. And I want to share too, going back to when we said about what you need doing a breath or meditation or mindfulness for what you need. Can we just talk about how getting your needs is so safe for the brain? I mean, in PRT, we learn that. And that's what all the time, like, what do you need? What do you need? We have no idea what we need. Do we need compassion? Do we need grounding? Do we need safety? And once you start checking in with what you need, you can give that to yourself and not rely on someone else or rely on Instagram to give you safety, rely on food to give you comfort. This is internal. So this is really huge. We numb a lot in society. We don't want to feel things. We don't want to be still. So like Dr. Matt said, like that resistance is what we need to move through. Yeah.
Yeah, really beautiful. I'm gonna hold that note. And just by the way, there are some questions I'm going to bring up. I'd love Dr. Matt to address it. Also, for anyone listening, this is live now, but it'll be recorded tomorrow up on the YouTube channel. And there's another opportunity to ask questions to Dr. Matt and Jeannie. So feel free to ask right now. And if we don't get to it, we are here for you. You guys know that about the TMS Roundtable, to support you and keep inspiring you. So, from Marina, please talk about 24/7 all over type of pain and no change with emotions or weather.
Mm.
Dr. Matt.
Yeah, sure. Yeah, that's such a bummer. I mean, is there a cause? What's the cause of the pain? And w- that's first kind of thing. I mean, you don't want to practice breath work and meditation if you have metastatic cancer, right? That could, that might help you to calm down enough to like seek the care of an oncologist or something, or evaluation or something like that. So I'm not sure panic or dissociation is ever a good sort of response, even if we have structurally based pain. But from that standpoint, if you're really confident um, that there is, this is neuroplastic pain, this 24/7 untriggered pain. Um, yeah, I mean, it might just take continued work to recognize what are the inputs to the threat, and continuing to try like different modes of not only like regulating and alleviating, these threat and stress and pain states. I mean, in PRT and somatic tracking, we teach people like if your pain is over a 7 or 8 out of 10 pretty consistently, you should stop somatic tracking,
Hmm.
because
Yeah.
you're liable to like get into this kind of get into a setback or almost like a re-traumatization, because you're kind of starting to like force yourself. It's sort of saying like telling yourself to calm down when there's actually something really bad happening, right? And so that state, you kind of want to come out of there and have some good avoidance behaviors we talk about. Sometimes those are medications, or
Yeah. Yeah.
sometimes they're just passive therapies like body work or something like that. Maybe breath work. I've felt major um, um, state shifts when I do breath work, and usually more intensive kinds of breath work. I've
Okay.
really benefited from the teachings and practices of Wim Hof, and so I find those to be the Wim Hof method is that's a guy, WIMHOF.
Yeah.
two names. So maybe you've talked about this before on the
Yeah,
podcast, but
yeah.
um, yeah, I can. There's a that's a really therapeutic effect for me, and I can feel a real sense of a shift in my system for that. That may be of real use for you. Um, but it just depends on what can move the system, one, and how we can like crank down from like a 9, 8, 7 out of 10 to a 6, 5, 4 or less, and then begin to like go again. And
Mhm. Look, I think I ask, every show there's this comes up and I always lean into, my teachers and my mentors. I'll ask Dr. Hanscom and I've asked Dr. Clark this and, I've talked to Dr. Schechter about it and Brad Fanestiel, is coming on the show in a few weeks. Like we talk about this because people are stuck and they know it's TMS and they're stuck. So they're intellectually like there. And so for Marina, Dr. Clark, quote, there's something in your brain still believing that you're living under threat. And you need to look at that with love and compassion and bring safety and calm in any way you can. And I'm not undermining, but in some way to, take that threat physiology, come into this safety, calm, and, and do the best you can and practice and get support, get a coach and help. There's enormous amount of support and love and compassion, and you're not alone.
mhm.
So I just want to bring up Jane's question, and maybe, Jeannie, you can look at this one. I've tried mindfulness and meditation before, but I get frustrated when my pain doesn't go away. How do I know if I'm doing it right or if it's even helping?
Oh, Jane, Jane, Jane. This is so common, and this is just I'm sending you so much love because I get it. I mean, all of us get this. So again, there is no right way to do a practice, right? And so again, we're getting stuck in this perfectionism, and we want to, just like Dr. Matt said, this beginner's mind of starting small. So I get frustrated. Well, first of all, let's just clarify. We talked about that. Maybe I've had people do some breath work. I teach a longer class, so this isn't a 3-minute but in my class, and the pain can shift and move and go away, but it can be temporary. It's not like we're healing, and just like in a somatic practice, someone can have their pain go away. Now, it doesn't mean it's gone forever. So I think the mindset shift is you're doing the mindfulness meditation for safety, you're doing it to calm your nervous system, you're doing it to be still, you're doing it to get into your intuition, all these different things. We need to shift the focus. So I think that will be really helpful. And then feel the frustration. Okay, great. You're frustrated. Where do you feel it? What's going on? For me, frustration's a pit in my stomach. All right, let's just meet it. Take the, like we say, take the boogeyman or the monster in the closet, right, Tovah? Like, let's take that out. Like, feel that frustration. The frustration's there. Great, feel it. And then maybe you're actually angry. Great, feel
Yeah,
your anger. That's safe too. This is just like a plethora of opportunities for us to dig deeper.
good point. Really good point.
Mhm.
Dr. Matt, can you answer Rachel's question? When I try to meditate, my mind races and my body feels tense. Do you have any advice for people whose nervous systems are too activated to sit still?
Yeah, I mean, you're like a lot of people. I will say that you're not. I'm sorry, you're not special in that way. There may be a certain intensity. I'm not trying to minimize your experience there, but the intensity to your fidgetiness or whatever. But um, yeah, don't give up. Number one, and number two, you might need to do something a little bit more active. Like this is where I might use a couple of rounds of Wim Hof breathing before I start meditating. So I can like feel a charge come up and then release through these breath holds and that kind of thing. And like it really you can mobilize or move through or um there can be you can do a little bit of exercise or something very intense beforehand, and as you tense up or move this energy through your muscles and that kind of thing, and then you're in the cool down phase or just relaxation after, whether it's a breath work round or it's some like
Beautiful.
sustained contractions or yoga positions or something.
Walking meditation. I
Yeah,
mean,
yeah, good, yeah, right, sure.
exercise is somatic. I mean, Tai Chi and Qigong. I mean, this is powerful. Centering, grounding, walking barefoot. I love this grounding. This is a very another interesting topic about inflammation. And just trying a walking meditation. I mean, this is very creative. And, it was actually Martha Stewart who brought this up in her book about you. you can't be creative and anxious. It's either anxious or creativity. So move it into creativity. And if any of you smart and sensitive people out there, I'm sure that you're all very creative and like be open and receptive to your amazing selves. Like don't, like I know it feels like you're stuck, which leads to the next question, which is an interesting question from James about I understand the importance of slowing down, but being still makes me anxious or frustrated. How can I make peace with stillness? Wow, it's a packed one.
Yeah, and I'm a more of a psychodynamically oriented person, so and the emotionally based therapies resonate actually as much or more than like PRT kinds of and CBT related things, and so uh, oh, uh, just this example is one way of looking at this notion of um, a statement I heard maybe a year ago. If it's hysterical, it's historical. Okay, well, that's interesting. And disregard any like loadedness of the word hysterical. Okay, if it's really intense, and so this notion that your system mounts this like threat response essentially to being still. Well, one that's worth inquiry, right? I heard the same thing in Doc Tovah about and maybe it's creativity or maybe it's curiosity. It's really hard for the brain to be in a state of probably creativity or curiosity and threat at the same time. Like the curiosity is more of a safe state and it will win out. So you can cultivate that, right? And so if you can do that around the stillness, but if you can also think about, and maybe this isn't during this specific mindfulness or meditation exercise you're doing, or if you set a timer for 10 or 20 minutes, you might, continue to work through the exercise. But before or after that kind of thing, like, well, tell me about stillness in your life
Yeah.
and tell me about activity. And this has been really useful. I mean, my difficulty with mindfulness practice and recognizing that I'm fidgety and have had energy. And God, that's actually been there since like elementary school. Like I'd even say since kindergarten.
Past
And
life
well,
Dr. Matt.
maybe that, and I don't have like great awareness of that personally, or I have. That's not been part of my therapeutic journey yet. Um, but boy, when I can connect to like what was going on in kindergarten for me, well, a lot actually, and as I can connect to that pain and to the stressors in my life at the time, and some, this was the first time I really went to a bigger school and a lot of peer pressures and fitting in and shame and things that, and even I went to a religious school. So there were kind of religious pressures, a lot of connotations there that weren't all that useful for my energetic little system. Gosh, um, I've heard that compassion and self-compassion is like the skin of self-knowing and self-understanding. And so this idea when I can start to like understand my fidgety, like my difficulty being still through this lens of, boy, I have experienced things that were really hard and devastating. And maybe I don't need to just be telling myself to be quiet all the time. I need to understand also, like, boy, here's why I hate being quiet, or I was told to be quiet all the time. And there's like anger in here that is probably gets triggered every time you slow down or try to practice meditation or get still. And feeling into that can be really relieving and completing in this way we've talked about, that can then like give you kind of breakthrough into stillness later. But it's like it's by going into it and being with it and not just being frustrated at yourself or how terrible of a meditator you are because you can't hold still or calm your mind.
Beautiful
It
point.
allows you even to explore the difficulty, the symptoms that you get when you try to do mindfulness. Even those are there to protect you. They're pointing to something important, just like, in my opinion, every TMS symptom is pointing to something important.
Beautiful. Well, beautiful, beautiful, beautiful. David's asking, how do we balance stillness with action? At what point does mindfulness become, these are brilliant questions. At what point does mindfulness become a bridge to re engaging with life instead of retreating? But again, I don't think mindfulness is retreating, but that's David's opinion. What do you think? Jeannie, do you want to tackle this one?
Yeah, and I also wanted to say, going back to the other question from James, something that I think could be helpful is if we never do something. So if someone used to ride a bicycle, now they have pelvic pain, they never ride a bike, right? It's like we think, oh, I never ride the bike. The brain learns, oh, the bike, that's dangerous, right? So it could be also if we never meditate, we never do mindfulness, that's dangerous. Okay, makes sense. So how do we start to reprogram the subconscious mind? By doing it. If you did 30 seconds of mindfulness a day or 30 seconds of meditation, so you're doing it 4 times a day, the next day 5 times, but short, then the brain learns, oh, wait, this isn't dangerous because we're doing it. So again, this is part of the behaviors that like if you do something or you don't in our world, it brings safety, right? If we never feel our emotions, now the brain thinks that's dangerous. So I just wanted to add that it's not about I did it for 30 seconds, it didn't work. It's still working, just like anything we do because it's reprogramming the brain.
Beautiful.
So I think
Beautiful.
for
Yeah.
balancing stillness with action, it depends on what you need. When I'm working all day and I'm in my flow, great. I don't need to stop and meditate for me personally. But I know, like yesterday at the end of the day, I had, a little frazzle feeling. And that's the point where I slow down and really give myself that break. So checking into what you need is great. Or if you like to have that consistency in a routine, maybe it's every morning you meditate and bring stillness just to create that routine if you're not used to what do I need in the moment. And I always say it's always figure outable. So if I had a client after when I was feeling a little maybe stressed or something, then I could give myself a 2-minute meditation or a couple deep breaths. It doesn't have to be all or nothing. It's always what can I do?
Excellent. This is a great this I'm just gonna mention 2 things, which is another whole broadcast, maybe we can meet again. And I've spoken about this with Dr. Brad Fanistil, and it's something from Dispenza's work, um, mental rehearsal. And even if we can imagine us being quiet or still, that's part of the habit forming, and the brain that's a whole nother thing. But remember, there's a study about, there's some kind of study that if I imagine my muscle moving, that actually they've done tests on that the muscle will get stronger, like something like this. There's a lot to this imagination and visualization, which is all part of the mindfulness and meditation and being still and the awareness. And it's chemical. I mean, when your brain, if you start to imagine and your conscious and unconscious mind, this is just a whole nother topic. And it's just a beautiful work. And so there's um a lot of resources out there for our listeners and for our community to and it's all on the internet. It's all for free. You can do this. This is just you and your mind and your choices, your hope, your vision, your belief, your gratitude, So I'm going to answer Grace's. Let me just bring Grace up. A show on stream. Hold on. There you go. How do you know if stillness is healing or if you're just disassociating or numbing it out? Good one, Grace. Sometimes I can't tell the difference. Dr. Matt?
Yeah, I mean, I think the felt sense in the body um, is can be really useful in that regard. I mean, dissociation is sort of like a dissociation from the felt sense of, an embodied state. And so, if you feel like your body, you're in your, like you can feel yourself on the inside, you don't feel like a hollow drum or numb or like you have Mickey Mouse hands or, there's these kind of weird distorted sensations. Those are all signals and signs or symptoms of dissociation, like a detachment versus like my mind. I can pause or I can see my mind chatter, but I can also feel myself in the chair in the moment, or the feelings in my rib cage or along the, in the floor of my pelvis as I breathe in and out. Like those aren't signals of dissociation. And so, yeah, and that's about the best I can do. I mean, yeah, some people can get into kind of trance-like states, and there's some overlap from dissociation there, but at the same time, I would say a tree is judged by its fruit. So like, is the fruit of your life that you're just kind of numb, or that the needle's never moving, or that it's not getting easier to recognize, like when your states of reactivity are coming up and down. I mean, mindfulness for me has been a vehicle for me to have a different relationship and a new kind of attunement with my body, not a hypervigilant one, nor a dissociated one, but And it's not perfect. My God, sometimes I definitely go to those sides of the spectrum. Still, I'm not the Buddha or Dalai Lama or whatever, like we said, but this notion that there's just a friendlier relationship with my body, and these experiences, I can sort of receive them, or look at them through a lens of curiosity. Um, and I don't think dissociation and curiosity really go together that well, or dissociation and beginner's mind, and non-judging and acceptance, and patience and trust. Like, I don't think you'll notice that um, you're starting to inhabit those qualities if you're just
Yeah,
dissociating all the time.
yeah. Great answer. So this is the last question because it's on the hour, and it's in the middle of the day, so it's Jeannie's work day and Dr. Matt's work day. So we're going to take one more question, but bring your questions, put them on the YouTube, and I will directly send them to Dr. Matt and Jeannie because they're wonderful questions, and I'm really happy for you to be here. So from Patty, how can we not want our pain? How can we not want our pain symptoms to go away if it's making our life miserable? I find it so challenging. Dr. Matt.
Yeah. Last one. I tried befriending him, but it feels like does not want to be my friend, or is torturing me, feeling hopeless at the moment. Yeah, I would go into the hopelessness. Like, can you walk with yourself into the hopelessness, or with a therapist or a coach or a friend, or a writing practice, or whatever, and allow your system to feel hopeless? Because even if it feels bottomless, it's not. And I would also say, like, of course you want to get out of your pain. That's very human of you. That's very animal of you. We are animal too. Okay. And much of our brain. And so, an animal will chew off its leg to get out of a trap, to get out of this pain. But going back to this, like, notion of a baby with a hair wrapped around its toe, and its toe is, like, getting infected, or getting ischemic or something like that. Like, um, we care about that baby, I hope. And not that we're babies, or yes, we have an inner child, all that stuff, but, like, as much as we want to get out of pain, we really want to get well acquainted with the causes of it. And there are causes. TMS is not just caused from, like, a crazy reactive dramatic brain. And that maybe is sort of what you've been told, or this is in your head, or whatever. Like, this metaphor of a false alarm can be really useful at times, because maybe the problem isn't the tissue anymore. So it's a false alarm if your smoke detector is going off, if somebody just took a steamy shower in your house. And so that's fine. And we wouldn't want to hose down the walls just preemptively. We want to try to figure out, you know, is the house on fire? But steam still set off the alarm, right? And there's danger in the air. And this is a danger and threat problem, a fear problem, not a tissue problem. And so we still want to do our best to continue to be curious and interested in, like, what's causing this baby to cry? What's causing this alarm to go off? It's not crazy and broken. My brain is not a deranged, masochistic, entity here that just wants me to
Body is
suffer.
protecting you, not
Doing it
punishing.
for reasons. Yeah. And so that's exactly right. And um, so of course you want your pain to go away, just to your question. And we want to equally, at least in equal measure, continue to search for, with as much, like, equanimity, but also persistence as possible. Like, what, I trust my system. I know this is happening for reasons, even if it's not just the disc bulges, or the weak core, or the glutens, or whatever I've been told. Like, um, but something's setting it off. More often than not, it's either something emotional, or something from the past, that is sort of like the present smells like the past to your primitive brain. And these are kinds of things where it, like, I think, was it Joseph Campbell, the cave you fear to go into has the treasure you seek.
Yeah.
Like, boy, our symptoms, if we can cultivate a better relationship, and more equanimity and peace to be with it, using breath work, using mindfulness, using journaling, using, I don't know, just fun, and maybe even body work and some other things, like, um, all this whole, like, effort to create safety so that we can be with and listen to ourselves and our systems more fully.
What a beautiful note to end on, and I'm already planning our sequel. M Meet again. Can
Sure.
we meet again for part 2?
Yeah,
There's
whatever. I'd
so
love to.
much here. Because guess what? It's about repetition,
Yeah. Yeah.
repetition, repetition, and we have to learn new pathways and repeat it. So this is gonna be a recording, but we're gonna come back live maybe in a few weeks, maybe after Christmas, we'll meet again, and we'll just pick up where we left off. Because this is really I feel so blessed. I learned so much, and this is part of my dichotomy. I wanna just sit here and listen and learn and and be the host. So thank you, Brian, for your help, my producer and assistant.
Yeah.
Jeannie, you're amazing, and I love you, and Dr. Matt, I'm so happy to meet you,
Yeah.
and
Same.
and hopefully someday we'll all meet, in the flesh, but it's so nice, and I'm very grateful to the
Yeah.
internet.
Yeah.
No complaining here. To the internet. And I thank you. Have a wonderful day. Bless everyone, all of you in the audience and in the Facebook feed. Come back again next week and meet us on the YouTube channel if you have questions. Again, bless your hearts. Thank you so much.
Everybody, be well.
Okay. Have a wonderful rest of your day.